Don't stop. I love that. Hi, welcome everybody. My name is Kathy Brown. I am the Director of Public Policy and Advocacy here at Paraquad. On behalf of our leadership, our board, and our staff, I want to welcome you here today. It is so wonderful to see so many health, mental health, and disability advocates here. We are here because of you and because of your advocacy to celebrate the passage of House Bill 1565. So congratulations to all of you. I'm extremely proud to introduce my boss, Amy Waymeyer. Amy joined Paraquad in 2013 as Executive Director and CEO. That made her just the third CEO in Paraquad's 46-year history. She oversees more than She oversees more than 150 employees in 8 main program areas that serve more than 3,000 people annually. Amy's driving passion is the economic self-sufficiency and independence of people with disabilities. Please give Amy Waymeyer a very warm welcome.
Good morning, everyone. And welcome. So, as Kathy mentioned, I am President and CEO of Paraquad, where we empower people with disabilities to increase their independence. And it is my pleasure and honor to introduce to you the Honorable Jay Nixon, Governor of Missouri. Governor Nixon is an advocate who has, since he took office in 2009, pushed Missouri to be a leader in policies that support individuals with various disabilities to achieve their maximum independence. His unparalleled and relentless advocacy for people with disabilities has materialized in the form of greater access for individuals with mental illness through the placement of mental health liaisons at the community mental health centers and mental health first aid training, enhanced supports and services for those with developmental disabilities through the Partnership for Hope, provider rate rebasing, and the virtual elimination of the wait list for services. He supported critical funding for mental health and disability services, including adult dental, which you've all been waiting for, and the pursuit of affordable, accessible health care that meets people's needs through the Medicaid expansion. Today, we celebrate the passage of a key piece of legislation that we hope will change the conversation for access to supports and services for people with disabilities. We want Missouri to be a state that agrees that people with disabilities should not be subject to a life of poverty just because they need support in the community. We honor Representative Kevin Engler for his sponsorship and advocacy on this legislation, and we also celebrate the legacy of our governor who kept our issues in the forefront for the last 8 years. His commitment and expertise will be missed greatly in Missouri. So ladies and gentlemen, our governor, the Honorable Jay Nixon.
Thank you, Amy. I'll mention Representative Engler real quick, but we are going to go down today and do a ceremonial signing later today in Farmington, in his hometown. I think his leadership was extremely important in getting this done. I appreciate Kevin's hard work. I want to thank all the dedicated caregivers and advocates that are here with us today. Paraquad is a shining testament to our shared values as Missourians and the joint obligation we have to our most vulnerable citizens. Growing up in DeSoto, down in Jefferson County, I went to Central Elementary School a very long time ago. Back then, students had challenges were warehoused in a separate building. And sometimes even at recess, they were targets of jeers. I remember at a very, very young age, as we went out to the playground, understanding how wrong this was. And I have been, since that time, trying to do something about it. That experience taught me some fundamental lessons that have stayed with me my entire life. We aren't all given the same gifts, but we all have the same rights. And our service will ultimately be measured at heaven's doorstep by what we did or did not do to help those in need. That's what brings us here today. In just a few moments, we will mark a major milestone in our efforts to improve the lives of Missourians with disabilities and their families when I sign into law House Bill 1565. This legislation will, for the first time in more than 4 decades, Kim, I'm sorry, I forgot to mention Representative Gardner. Thank you very much. We wouldn't be here but for her co-sponsorship of this measure and her indefatigable efforts to, in a classy but persistent way, wrangle votes to get this thing done. Thank you, Kim, for your leadership. So for the first time in more than 4 decades, raise the asset limit for Missourians who qualify for age, blind, and disabled Medicaid coverage. For more than 40 years, in order to have access to the services they need to live more independent lives, Missourians with disabilities have been able to keep no more than $1,000 in assets. That means they can't save up to pay for things not covered by Medicaid, like certain repairs to a wheelchair or a home or higher education. Quite frankly, those just aren't Missouri values. That's why I'm pleased that under this bill, beginning in fiscal year 2018, the asset limits will increase until they reach $5,000 for individuals and $10,000 for married couples by 2021. That is a huge step forward for something that hasn't been touched for 40 years. Now, after 5 years, those of $1,000 increases, after those 5 years of $1,000 increases in fiscal year 2022, there'll be a cost of living adjustment that kicks in. So going forward, that means we are not doubling or tripling the limit, we are raising it totally here by 500% once it's fully in place. And I'd ask that you applaud for the folks that worked so hard to get this done. We all know that this will help thousands of Missourians live more independent lives. Folks who just want a chance to be responsible and save for the future, but a law written more than 40 years ago wouldn't let them be part of one part of the American dream, which is having some assets. And today, in a few moments when I sign this, we're going to do something directly about that. Now, this nonpartisan legislation is another step forward in our efforts to improve and enhance the lives of Missourians with disabilities, and this legislation would not be possible, as I look around this room, without the people in this room and other rooms like this that have taken their time to, in a respectful but persistent way, work with all the policy folks in the legislature to get this done. So with that, what I'm going to do is I'm going to sign the bill, and I'm going to come back here and make a few short comments. Then I'll be glad to take some questions. But I don't want to hesitate too long. We need to get this thing working. So I'm going to sign House Bill 1565 and make it the law of the land. Chances I'm supposed to smile more. I'm just going to say a couple other things just because there's a podium and a microphone. And I'm going to take questions in just a second. But I just want to put it in context really, really quickly. This landmark achievement builds on the historic investments that we're making this year to empower Missourians with developmental disabilities and behavioral challenges to live fuller, happier, more productive lives. In total, the fiscal year 2017 budget includes an increase of more than $200 million for our Department of Mental Health, including much deserved 3% rate increase and rebasing for the outstanding network of providers that are out there. We feel extremely strongly that the people that provide services, the people that provide professional work in the areas here need to get a living wage too. And it's extremely important to all of us that if we're going to ask folks to be involved and we're going to have certifications and careers, that we make sure that we've got a pay scale that can have them live independent lives also. Now, before I wrap up and take questions, I just want to say thank you. In the past 3 decades, I've learned a great deal from the people that I've had the privilege to serve. I've learned that Missourians are stronger, more resilient, and more generous folks than you could ever imagine. And I've learned that the folks with the greatest challenges will also have the most to contribute. You just give them a chance. My mom taught kids with developmental disabilities. In fact, after she was diagnosed with cancer, she asked and got a transfer back into the classroom. I'm confident that she gained as much strength and inspiration from teaching from those folks that she was teaching, and it increased her life. She passed away before I became a state senator, but I'm still, each and every day, trying to live up to her incredible high expectations for me and her ideals. And we have an obligation to serve all Missourians. The only bad thing I say about my mom, and no one should ever start any sentence that way, is that she got her PhD at the same time I was at the University of Missouri. And going to college as a freshman and seeing your mom walking around campus was a little cramping on my personal style, let's put it that way. And then on top of it, her having a straight 4.0 the entire time, not only being there to watch what I was doing, but also getting better grades than me. But I saw her improve herself professionally, and with those additional skills make a real difference in folks' lives. And it's been an inspiration to me my entire life. 7 years ago, institutional placement was the only option for far too many Missourians with developmental disabilities and their families. Today, our Partnership for Hope is changing that, keeping families together and helping thousands of Missourians live full, meaningful lives. 7 years ago, most insurance policies didn't cover applied behavioral analysis for autism, and as a result, most families couldn't afford it. Today, because of the law we signed with bipartisan support in 2010, thousands of children are getting the therapy they need. In a testament to how far we've come, according to the United Cerebral Palsy National, they say Missouri has now risen to 3rd in the nation and 2nd most improved for providing high-quality developmental disability service. 3rd in the nation. We are on the move. Those of you that know me know that if you come to my office or my home office, though, I don't hang up bronze medals. Okay, so we got to keep going. I mean, we've made dramatic progress, but this journey is far from over. In conclusion, I once again thank the dedicated caregivers that are with us today. You have answered one of the highest of callings. It's difficult work, but it's important work. And on behalf of 6 million Missourians, I thank you for your dedication and commitment. Together, we are building a future where Missourians with developmental challenges can step out of the shadows and into the light, and where all Missourians have an opportunity to live up to their God-given potential. So with that, I'll be glad to take any questions that the press or anybody else has. That's good. I'll be available for off-topic questions if you want them in a minute. This is not a good room to. I'm sorry, I couldn't see. Anybody? Yes, sir.
We need Medicare, Medicaid, and do something about that, and Social Security. Don't do something about those.
Clearly, I have supported, and I believe it's the right policy for the state to move forward and accept the federal dollars that are available to states to dramatically expand coverage, not only for folks that have challenges, but also for the working poor. And I am hopeful that examples like this, where we are in a clear path forward, moving forward to draw down these additional dollars, can be a jumpstart to the discussion to get those Medicaid dollars here in Missouri the way they are in 30 other states right now, helping folks to move forward. So I am hopeful that we'll get that done. I think today, is a tangible example of a step forward, but is not completion, that's for sure. And there are great opportunities out there to help 300,000 people that need health care and who have income, meaning they're working, but don't have the basic benefit of health care, and we need to move forward, hopefully, in the coming months and years to get that done. As far as Social Security, I understand what you're saying. And support it. What you're talking about, have limited ability to make that national change as a governor, but you didn't come to hear excuses from the chief executive. But I think you're right on that. I think that's a federal issue that we need to keep talking about, though. Any other quick questions? Yeah, Jason.
On the topic of Medicaid expansion, you were pushing for an expansion of eligibility even before the ACA was part of your 2008 campaign, but you're leaving office with this, which is significant, but not an expansion for everybody. First, I guess it's a two-part question. How do you feel about that result, and what do you think it's going to take to move the needle forward? Well,
we have, like this bill, moved in areas within the limited authority without the legislature moving forward where we've made a difference. I mean, the Partnership for Hope, for example, draws down Medicaid dollars in a unique way, one of the only waiver of its type when it was passed, that now helps about 3,000 families. That's a significant and positive movement forward. There are other areas where we have tried to be, for example, 100,000 more kids have health care in the state of Missouri than the day I was elected. Because while they haven't passed Medicaid expansion, we've worked really hard, Department of Social Service and other departments, to reach out, find those people, and get them the coverage that they deserve. So in those areas, we have done with the authority we've had. We've made significant progress. Once again, I just hope that this is the moment that people look back to in which they say that the politics of that issue subsided and the progress possible, and the fiscal responsibility of all of us that serve at the state level to draw back into our state as many federal dollars as we can. They're not federal dollars, they're your dollars. When you pay your taxes, you pay a bunch of them that go to D.C., I think we have a responsibility incumbent upon us, once they change the framework of how to get those, that we draw those dollars back. And I think things like this will be a solid step forward to get that policy piece done. I mean, and you'll think this is a bizarre analogy, Jason, but you have an odd twist sometimes on the news, so you can probably tolerate it. Yesterday, the Missouri Highway and Transportation Department voted to move forward on a project that the city of Washington has been working on probably for 20 years, building a new bridge across the Missouri at Washington, Missouri. This year, we also made the necessary steps forward to get a new bridge, one we had to close last year for traffic for a while in Louisiana, Missouri. Two significant pieces. A big part of the dollars that will ultimately pay for both those projects are gas tax money paid for by Missourians that went to the federal government. I wish we could be as equally